So, hello everybody, welcome back to the platform of Unacademy. And today we are going to now again start with very basic topics because now we have to aim for the upcoming exam. So, without wasting any more time, we are now going to start with the important topics, and very nicely we are going to finish all the units related to this subject so that all of you are well prepared for your target exams now. So, considering pediatric units that we have to discuss, we have already discussed in detail about the general pediatrics part. So now we are left with the systemic pediatrics, and so we are going to start with all the important systemic parts, and we are going to take it slowly and we'll finish it well in time. Okay, so now again I would like to request all of you, those who have not subscribed yet, please come and subscribe, so that once you subscribe you're going to become a part of ours plus our classes, where you can attend the classes easily, understand the topic in detail, and you are able to focus on a particular unit and you will perform nicely in the exam. Okay, so today we are going to now start with pediatric nephrology. So nephrology is a very important unit, highly scoring unit, because a lot of questions come from this unit, and the best part is it is very simple to understand. So there are very basic topics that we have to read from the kidney chapter. And for all of those who are preparing for either FMG, INICET, or your next year's NEET PG exam, all of you should read the unit in detail and start attempting the MCQs side by side. So today we are going to start with pediatric nephrology, and the five-star topic in this unit is nephrotic syndrome, which all of us need to be very clear about. So we'll do it in a little detail because this is the most important topic, और जो recent update के questions भी आते हैं, that comes from nephrotic syndrome. So before we start, a little word about Unacademy and the subscriptions. So those who have yet not subscribed, it's the best time to subscribe right now because you won't be wasting any time. So if you take a subscription, you are able to save a lot of time and effort, as I keep telling in all my sessions. So this is because once you start to take a subscription, you are able to attend the classes online in the comfort zone of your own study room. So that saves a lot of time. You don't have to travel here and there to attend the classes. You don't have to uh, go physically to attend any class. You can take all the classes online. You can also attend the quizzes and the live tests, and you can also attend the special classes from where you can see that what is the response your other competitors are giving. So once you are a member of the plus subscription, you get a lot of benefits. So those who are only following the YouTube channel and the special classes, we have this paid subscription to offer, which is a very good subscription, and the benefit is that you are able to attend the live and recorded classes anytime and anywhere. So you can plan your own schedule. अब जैसे अभी जो लोग नेफ्रोटिक की क्लास नहीं अटेंड कर पा रहे, because it's a very important topic, so if you miss any class you can just go to the recording and listen to it. So that becomes very important because you won't be able to miss any topic like that. अगर आपने 10 days दिया है कि मुझे CNS का chapter 10 days में finish करना है, in that 10 days maybe when the classes are going on, you're on duty, you might be post duty, you might not be available. So do you miss the classes? Of course not. You can anytime go and listen to the recorded version as well. You also get to learn from the top educators because all of us have been screened very nicely before taking the classes. So you can easily rely on the content that we are providing you for the exams. You also get to compete in the live tests and quizzes. So live tests and quizzes देने का ये benefit होता है that you know what is your rank and how far you are improving. तो अपने कॉम्पिटिटर्स के साथ अगर आप अटेंड करोगे, इफ you'll get a rank and you understand that what is your improvement day by day, so that gives you a positive feeling from inside that yes, you're going on the right path and you're doing the right amount of study. Then the best part according to me is that you can study from the device of your choice. Suppose आप duty पे हो, if you're having some free time, you can just listen to any lecture from your phone. So that helps you to keep in continuity, and that helps to keep in touch with the topic that you are reading. So this is very beautiful feature that I like, that you can just log in from any device and you can just start listening to the lecture. So being doctors and medicos, all of us are super busy with our duties and schedules, but we have to take out time for our own preparation. So those who are ongoing interns, those who are doing residency and are still preparing for the exam, I don't think anything could be better than taking a plus subscription. You also get access to 25,000 plus questions. So this is very important because these are supported by the explanation. So once you start taking the subscriptions, you get to attend all these important questions and the live tests and the quizzes and question banks. So इसके साथ ये फायदा है कि explanation में जो topic cover हो रहा है, that is the most potential topic that can be asked in the upcoming exam. So now because we are dealing with those candidates who are preparing for the upcoming exam. So you should be aware about all the recent updates, all the recent questions which can be framed from the same topic which has been asked in the last exam. उन चीजों को टारगेट करने का बेस्ट तरीका होता है explanations read करना. So please come and take the plus subscription so that you also have the access to these questions and you keep practicing and keep becoming wiser day by day. And those who are going to take the subscription for 12 months and above will also get a printed set of notes, which is very handy for your revision. So plus subscription is the most basic subscription, which I would love to offer to all those who are preparing for your NEET PG, upcoming NEET PG exam. So if you want to take it, you can come and subscribe as soon as possible so that we can uptake your classes in the plus hours as well. Then we have the iconic subscription. So this is a combo subscription. This is also one of the best subscription that we have because it is a combination of Unacademy and Prep Ladder. So it has a lot of benefits. From Unacademy, you get the benefits of plus classes, that is you get well structured live batches, you get the recorded classes to attend, you get 25,000 plus questions, you get the live tests and quizzes, and you also get the comprehensive digital set of notes. From Prep Ladder, again you are able to take all the benefits, that is your clinical essentials, your video classes, your question bank, rapid revision courses, and the dream notes. So because it is a combination of both, it gives you immense confidence that yes, you have prepared well for the exam, because if you attend the theory from this part and you go and attempt the quizzes and the questions from this part and you're able to do the same, so it is going to help you believe that yes, you're doing again the right amount of study, and this positive feeling from inside about yourself is very, very important. All right, so regarding the batches, now those who are freshers, as of now we have started the target next 2022 batch. So this batch has been planned to start from 15th, where you can again take all the 19 subjects in depth. You can again revise everything. You can attend all the live tests and quizzes, the grand test, and everything is included in this package, whatever, anything and everything that is required for your preparation. So please come and subscribe. Whenever you do so, you can use my code, which is Kavita S10. If you put down this code, you get additional discounts on the package and it becomes financially friendly also. We also have got the Focus FMG batch for the FMG exam that is coming up right now. So it is a duration of 3 months only, again starting from 15 September. Here also you get all the benefits. So those candidates who are targeting the next FMG exam, you can come and start to prepare from this batch. Then we have a new clinical examination and procedure batch starting from 15 September 2021. So this also includes a lot of benefits, like your classes are included in this. You also get the modules, you get the recorded versions if you miss any class, and the PDF of the notes and the sessions is also available. So come and boost up your medical preparation for the next NEET PG exam. So we have a very good offer right now. That is a 24-month subscription and you get additional 4-month subscription free for that. So this is a limited period offer. So all of those who are interested to subscribe right now, this is the best time that you can subscribe. So whenever you do so, please use the code Kavita S10. If you put that code, you get additional discounts and offers on your package. So we also have the 12+2 offer. So whenever you take this offer, you get additional 2 months free of cost to access to your course. So the NEET PG subscriptions are running right now to the best of the potential and we expect a lot of students to enroll. So we have the plus and the iconic. Whenever you subscribe, please go to your NEET PG section on the Unacademy app. You can open it, you can select the duration that you want to purchase and you can make the payment. When you do the payment, please use my code, that is Kavita S10. So it is going to give you additional discounts on the packages and you can be a part of the plus hours. So this month, I'm taking sessions on cardiology unit and respiratory pediatrics. So all of those who want to study these units in depth and want to complete it off this month, please take the plus subscription so that you can come and listen to the plus classes as well. Okay. All right. Let's start with today's topic. So starting with today's topic, that is nephrotic syndrome. It's a very important topic. So we'll go slowly because now we need to build up our concepts. And once our concepts are clear, then we can do a marathon revision for the topics when we end the complete unit. Okay. So regarding nephrotic syndrome. So what do you understand by nephrotic syndrome? Now, first thing is that it is a very, very common syndrome that is seen in children. So nephrotic syndrome is a very common disease. It is well developed, it is well present in developed and developing countries both. So the incidence is very high. In India, it is approximately 100 per million So you also get number-based questions in your NEET PG exam. So you should be well versed with some important figures that can be asked in the exam. Okay. So nephrotic syndrome is not a rare disorder. It is a very common disease which occurs in pediatrics. And regarding the incidence, it is approximately 100 per million in India. So this can be one question that can come in the exam as a simple number-based targets. Now, what is the definition of nephrotic syndrome? Very important. All of you should remember it by heart now itself, because you can be asked about the definition in any format. All are true except which of the following is the best definition. All of the following are true. Please choose the best statement. So there are different languages that the examiner uses to frame the question, but the concept is the same. So every year you have to target the concept clearing part. If your concepts are clear, you can easily solve the MCQs. So how do we define nephrotic syndrome? So you have got very important definition parts. First part is proteinuria. So what is proteinuria? Proteinuria means excretion of protein in the urine, right? So it is excretion of the protein. Now, how much protein needs to be excreted out in the urine so that you can call a child a case of nephrotic syndrome? So these are diagnostic criteria. These definitions are used for the diagnosis. ठीक है? तो जब भी आपको ऐसे कोई भी numbers मिलते हैं, you should immediately correlate it with the values that are given and with the units that are used. क्योंकि NEET PG exam में किसी भी one-liner question में the one tricky thing that the examiner does is that they will change the unit or they will change the number right in front of the unit. So that becomes very confusing. So you should be very sure of the number and the unit that you are using with it. ठीक है? So कितना protein loss होना चाहिए हमारे urine से so that you can call a child a case of nephrotic syndrome. So for this, we don't do a spot urine test, which is very not very diagnostic. For this, you need to collect the urine over 24 hours. ठीक है? 24 आवर्स में जो प्रोटीन लॉस हो रहा है उसको हमें मेजर करना होता है. सो 24 आवर्स में if it is more than 3.5 grams or it is more than 40 milligram per meter square per hour or it is more than 1 gram per meter square per day. ठीक है? So these three figures are very important to understand. So please take a moment to memorize it. It is 3.5 gram per 24 hours or more than 40 milligram per meter square per hour or more than 1 gram per meter square per day. ठीक है? अगर इसमें से कोई सी भी वैल्यू आपके केस में फिट हो रही है, then you can consider that case as a case of nephrotic syndrome. All right? Just take a moment to memorize it. Okay. All right. So this is the cutoff that we use for proteinuria. So always remember it is a proteinuria that is the most characteristic thing that happens in nephrotic syndrome. Second thing that we can use is or if the spot UP-UC ratio of more than 2 milligrams per mg. So if the UP-UC ratio that we calculate, if that is more than 2 milligrams, then it is going to be known as nephrotic syndrome. And alternatively, if you cannot calculate the UP-UC ratio, you can do a dipstick test. So once you do the dipstick test, it is a bedside test that is easily available. So this bedside test is available with the help of a dipstick that we have, in which you can easily label the amount of protein that is lost in the urine. So if you see the amount of protein that is lost in the urine and it measures more than equal to 3 plus. So dipstick is a very simple bedside test that we do. In this dipstick test, you have got a dipstick that is a stick which consists of color changing values. So you can easily measure the protein. Once you dip it in the urine sample of the patient, the color of this protein part is going to change. So the change of the color needs to be matched with the match that you have given. So इसमें जो भी color change आता है, it can be +1, it can be +2, it can be +3 or +4. So you have these numbers which are given. So if the color change that you have seen that matches with at least 3 plus, That means that much amount of protein is lost in the urine of that particular patient. So UPUC ratio of more than 2 or dipstick more than equal to 3 plus is another criteria for definition and also for the diagnosis of nephrotic syndrome. Alright. Apart from this, if you have decreased albumin हमारे body में decrease क्यों होता है? Because nephrotic syndrome में there is loss of albumin from the urine. So albumin is going to be decreased. That becomes less than 2.5 grams per deciliter. So the cutoff is less than 2.5. If there is generalized anasarca, so because of the loss of protein, what is going to happen? The human body is going to have retention of fluid. So because of the fluid retention, there is going to be generalized anasarca. So the whole body is going to swell up. The first sign of swelling that you see is periorbital puffiness. So clinical examination में this thing is very very important. अगर आपकी swelling face से develop हो रही है, that means you have periorbital swellings which is gradually extending to the whole abdomen and the feet and the hands, then we call it anasarca, which is of renal origin. That means there is some renal problem which has led to this kind of swelling of the body. So anasarca is another important criteria that is present in nephrotic syndrome. Then we have hyperlipidemia. Hyperlipidemia में क्या होता है? The lipid profile is going to get deranged. So in this lipid profile, you will find that the cholesterol is more than 200 milligrams per deciliter. Okay. So please take a moment to revise it now and finish it off itself. So once you revise things, when you have read it and you can memorize it nicely, then it remains in your brain for a longer duration of time. Okay. So nephrotic syndrome is a common disease in our setup. Its incidence is as high as 100 per million children. It is defined on basic criteria. The first criteria is proteinuria. If you have a proteinuria of more than 3.5 gram per 24 hours or 40 milligram per meter square per hour or 1 gram per meter square per day, that is one criteria which is known as proteinuria. Or if there is spot UPUC ratio of more than 2 or if the dipstick is more than equal to 3 plus. So anything that you find out of these three can help you to make the diagnosis of nephrotic syndrome immediately. Apart from this, there are supporting features like you can have hypoalbuminemia, which is less than 2.5 grams per deciliter of albumin. Then you have generalized anasarca, that is fluid retention in the whole body. And the first anasarca sign that we see is periorbital puffiness. And again, you have hyperlipidemia, that is increased levels of lipid in the body. So cholesterol measurement is going to be more than 200 milligrams per deciliter. All right. So those who are listening, is it clear to all of you? It's very important that you're clear with the concepts of nephrotic syndrome because you get so many questions on the definition and the cutoff. So each of these value is very, very important to memorize. Don't get confused. Just memorize it by heart because you get a lot of questions from this part. Okay. Cholesterol 200, albumin less than 2.5, dipstick more than equal to 3, UPUC ratio more than 2, proteinuria more than 3.5 grams per 24 hours, 40 milligram per meter square per hour or 1 gram per meter square per day. Okay? Alright, let's move on to the next slide. So coming on to the idiopathic causes. Now nephrotic syndrome can be primary, it can be secondary. What we have to study in detail is the primary form, which is mainly idiopathic. There are certain secondary forms also which can be caused secondary to certain problems in the body, which could be infections like malaria, any kind of heavy metal ingestion. So there are many causes which we'll see in detail again. But regarding the primary form, so idiopathic में आपके 5 types of nephrotic syndrome is present, which is based on the exact pathogenesis that these kind of diseases have. So which part of the renal system is involved, what is the pathogenesis and what is the exact manifestation that we see in the renal biopsy. ठीक है. So इसके basis पे you have got these 5 types of nephrotic syndrome. What are these 5 types? We have minimal change disease, which is the most common type. तो सबसे ज्यादा जो इंसिडेंस है नेफ्रोटिक सिंड्रोम की, दैट इज बिकॉज ऑफ दिस मिनिमल चेंज डिजीज. ओके, तो मिनिमल चेंज डिजीज के बाद है हमारे पास फोकल सेगमेंटल ग्लोमेरुलोस्क्लेरोसिस. फोकल सेगमेंटल ग्लोमेरुलोस्क्लेरोसिस, MCD, that is minimal change disease, FSGS, that is focal segmental glomerulosclerosis. Then we have mesangial proliferative nephrotic syndrome, mesangial-proliferative. Then we have membranous nephropathy or membranous type of nephrotic syndrome. And last we have membranoproliferative glomerulonephritis, known as MPGN. Okay? So these are all the important types of nephrotic syndrome that we have to deal with. Now because it is idiopathic, so we say If you get a question, which is the most common cause of nephrotic syndrome, what should be the answer? Anybody asks you, what is the most common cause of nephrotic syndrome? What should you answer? It is idiopathic. Nobody knows the cause of nephrotic syndrome, although it is very, very common in our setup. So idiopathic type of nephrotic syndrome is most common. अब इसमें से अगर कोई आपसे पूछता है इडियोपैथिक में सबसे कॉमन क्या है और सबसे ज्यादा इंसिडेंस किसका है, सो दैट इज मिनिमल चेंज डिसीज. So MCD is the most common type of nephrotic syndrome that we see on daily basis, and this is the one classical type which is seen in pediatric age group. So minimal change disease and idiopathic, two answers you should be very sure of. Apart from this, there are focal segmental glomerulosclerosis, mesangial proliferative, membranous nephropathy, and membranoproliferative glomerulonephritis. So please remember these 5 types of nephrotic syndrome. Don't get confused with this MMM wale names. So it is minimal change disease, which is most common. Then you have mesangial-proliferative, membranous, and membranoproliferative glomerulonephritis. Okay, all right. Now, apart from this, which is the nephrotic syndrome that occurs, which is idiopathic, we have certain genetic phenotypes of nephrotic syndrome. So there are many genetic causes which can lead to nephrotic syndrome. And this is a very, very important topic for your exam because you have been asked n number of times about these genetic causes of nephrotic syndrome. Okay? So there are many important genes, the mutation of which can lead to various types of presentation of nephrotic syndrome. All right. Now, regarding the genetic inheritance, we have autosomal recessive type and we have also got the autosomal dominant type. Till date, we have been asked questions on the recessive type many, many times. So it is expected that if you get an updated question or you get a recent update, you can also be asked on the autosomal dominant type. You don't have to remember the name of the genes for all of that. You have to be very sure about the first one, that is Finnish type of nephrotic syndrome. So these are all congenital nephrotic syndromes. Okay. You also get questions on what is congenital nephrotic syndrome and what are the genes that is responsible for a congenital nephrotic syndrome. Okay. So Finnish type is caused because of NPHS1. Please remember the name of the gene. It is NPHS1. All right. Then you have the corticosteroid resistant nephrotic syndrome. So corticosteroid resistant nephrotic syndrome is caused because of NPHS2. You can be asked about these two because they have not been asked till date. So you can remember the names at least. It is diffuse mesangial sclerosis caused due to PLCE1. And we have corticosteroid resistant type of FSGS that is caused because of MYO1E gene mutation. So just remember the names of these 4 genes and these autosomal recessive. Now, if you're asked about the autosomal dominant type, you should just know it is FSGS type. So it is the FSGS type which has got autosomal dominant inheritance. Okay? So from this chart, I would only expect you to remember the Finnish type, that is NPHS1, the corticosteroid resistant nephrotic syndrome, that is NPHS2 mutation, diffuse mesangial sclerosis, that is PLCE1 mutation, and corticosteroid resistant type of FSGS type of nephrotic syndrome that is caused because of MYO1E mutation. And if they ask about the dominant type, then please remember FSGS types are the dominant type of nephrotic syndrome. Okay, so we have autosomal recessive and we have got autosomal dominant type. So genetic causes or congenital nephrotic syndrome is a very hot topic in nephrotic syndrome. You will get definite questions from here. So I can only predict the important things which you need to study. So we'll deal with all the important topics gradually. When you compile everything, the whole unit gets completed. Okay, now since I was talking about the primary cause, we also have got certain secondary causes of nephrotic syndrome. So secondary causes of nephrotic syndrome are those which, if present in a patient, can lead to onset of nephrotic syndrome due to certain changes in the body. So secondary causes basically affect the renal system. It can be any infection, it could be any autoimmune problem, it could be anything. So any kind of cause that affects your renal system and leads to the same mechanism that is present in nephrotic syndrome is known as the secondary cause of nephrotic syndrome. So many infections are well known to cause nephrotic syndrome in pediatrics. Infections पे बहुत बार क्वेश्चन आ चुका है, so all of you should be very very clear. Hepatitis B and C, ठीक है, B और C बस बी और सी याद रखने हैं, और कोई सा हेपेटाइटिस नहीं है. सो दीज ब्लड रिलेटेड वाले जो हेपेटाइटिस होते हैं, हेपेटाइटिस बी एंड सी, दैट इज वेल नोन टू कॉज रिएक्शन एंड इट कैन लीड टू नेफ्रोटिक सिंड्रोम. HIV is well known to cause nephrotic syndrome. Malaria, syphilis, toxoplasmosis, endocarditis, the infective endocarditis that is present in the heart valve diseases, schistosomiasis, filariasis, and infectious mononucleosis. So these are all the classical infections that can lead to nephrotic syndrome. So if you have any patient who is undergoing these infections and there is no decrease in the albumin, or you find the dipstick is increasing, or there is microhematuria, or there is proteinuria in the urine, then you should definitely work up for the cause. That means because of this infection the renal system has been affected and these patients can develop nephrotic syndrome. Okay. So hepatitis B, C, HIV, malaria, syphilis, toxoplasmosis, endocarditis, schistosomiasis, filariasis, and infectious mononucleosis. These are all the causes which can lead to onset of nephrotic syndrome if the patient is having any of these infections. Then apart from this, we have certain immunological causes. So what do you understand by immunological causes? So any kind of autoimmune phenomena in the body which can result in the renal damage can cause nephrotic syndrome again. So immunological causes में we have got Castleman's disease, Chimera disease, bee stings, and food allergy. So whenever there is bee sting, that has got a heavy threat to cause nephrotic syndrome. So bee stings can also lead to nephrotic syndrome. Then we have the neoplastic causes. So neoplastic cause में क्या है? So neoplastic cause में, if any patient has underlying leukemia or lymphoma, then what can happen? Because of the underlying malignancy, it can also cause nephrotic syndrome. So underlying malignancy is very important to be ruled out if you're not finding the cause for nephrotic syndrome. So anybody who has got lymphomas or leukemias can have this reaction to the renal system and it can lead to nephrotic syndrome. Now another very important cause is drug induced. You have got n number of questions on this drug induced cause. So drug induced में कौन-कौन से drugs होते हैं which can lead to nephrotic syndrome? So all the heavy metallic drugs that we have like penicillamine, gold, NSAIDs, pamidronate, mercury, lithium, interferons, captopril. So all are the important drugs which can lead to nephrotic syndrome. Okay. So nephrotic syndrome के बहुत सारे cause हो सकते हैं. These are all the secondary causes that are important to be learned properly, because if you have any of these causes, it can lead to damage to the renal structure and it can cause nephrotic syndrome in pediatrics. So infections में hepatitis B, C, HIV, malaria, syphilis, toxoplasmosis, endocarditis, schistosomiasis, filariasis, and infectious mononucleosis. Immunological में you have most important to remember is bee sting and food allergy. Neoplasia में कोई भी underlying malignancy होगी like lymphoma and leukemia, then you should be clear about it. And drug induced, all the heavy metallic drugs like penicillamine, gold, NSAIDs, pamidronate, mercury, lithium, interferons, and captopril. So these are all the important causes, secondary causes which can lead to nephrotic syndrome in pediatrics. Okay. Alright, so we'll do this slide and we'll see the images for today so that you're clear with the types of nephrotic syndrome. So basically we have to see that nephrotic syndrome can be of the 5 types that we have studied. So what is the change that happens in these kind of disorders? So we have got minimal change nephrotic syndrome, we have focal segmental glomerulosclerosis, we have membranous nephropathy, and we have membranoproliferative glomerulonephritis. Okay. So in these, what is going to happen? Minimal change disease में basically everything is normal. So you should remember that light microscopy में आपको सब कुछ normal दिखेगा. You won't find any change. If you put immunofluorescence, you won't find any deposits in the podocytes, that is on the renal cells. So again, immunofluorescence is going to be negative in minimal change disease. The only clue that you have to diagnose minimal change disease is on electron microscopy, where you will see that the food processes effacement is present. Effacement of food processes is present, which is the most important finding that is present in minimal change disease. Apart from this, rest other findings are going to be normal. Okay, then we have the second type, that is focal segmental glomerulosclerosis. So focal segmental glomerulosclerosis में क्या होता है? On light microscopy, you will see there is focal sclerotic lesion. So focal sclerosis is characteristic. Focal कहने का मतलब अगर ये पूरा cell है आपका, so at some areas you will see that sclerotic patches are present. If you do immunofluorescence, there is definite deposition. So what gets deposited? You have got IgM and you have got C3 in the deposits of the podocytes. So immunofluorescence पे you have positive reaction to C3 and IgM. Once you do electron microscopy, again you will see that the food processes fusion is present. So food process fusion is going to be present on electron microscopy. So these are all classical findings that you see in focal segmental glomerulosclerosis. Then we have got the membranous nephropathy. So what happens in membranous nephropathy? Because it is like a membranous nephropathy, you can imagine everything becomes thick like a membrane. So इसमें light microscopy में आपको thickened glomerular basement membrane दिखेगा because that becomes thick like a membranous thing. On immunofluorescence, you will find very fine granular IgG deposits. On immunofluorescence, there is going to be very fine IgG deposits. On electron microscopy, what will you find? You will see there are subepithelial deposits which are present. Okay, so membranous mein it is subepithelial deposits. All right. Membranous nephropathy में thick glomerular basement membrane, very fine granular IgG deposits, and subepithelial deposits are going to be present. In membranoproliferative glomerulonephritis, you have two types. One is type 1 and type 2. Type 1, again, you will find a thick glomerular basement membrane which has proliferated and become like a membrane. Again, here you will find granular IgG and C3 depositions. And you will find mesangial and subendothelial deposits. Okay, ये अंदर के तरफ की deposit है subendothelial, which is seen in membranoproliferative. In membranous, it is subepithelial. It is right on the top. Whereas in part 2, if you see on light microscopy, you will find only lobulations are present. Only lobulations are present and deposits are only of C3, and you will see dense deposits. It's like a sandwich pack thing. So you will find dense deposits in cases of membranoproliferative glomerulonephritis. Okay. तो मिनिमल चेंज डिजीज में लाइट में सब कुछ नॉर्मल होता है, इम्यूनोफ्लोरेसेंस में कुछ भी नहीं मिलेगा, एंड ऑन इलेक्ट्रॉन माइक्रोस्कोपी यू विल सी इफेसमेंट ऑफ द फूड प्रोसेसेस. In focal segmental glomerulosclerosis, you will see that some of the areas have got focal sclerotic lesions. You have IgM and C3 depositions, and you have got food process fusion as well. On membranous nephropathy, you will see it has got a thickened glomerular basement membrane. There is fine granular IgG deposition and subepithelial deposits. On membranoproliferative glomerulonephritis, which is of type 1 and type 2. In type 1, again, you will see there is thickening of the glomerular basement membrane. There is granular IgG and C3 deposition, and there is mesangial and subendothelial deposits. Whereas in type 2, there is lobulation which is present, and C3 is the only deposit that you see, and there is going to be dense deposits on electron microscopy. So it feels like a sandwich kind of an appearance. Alright, looking at the images, because you can get a spotters as well in your exam. So if you see minimal change disease, there is nothing that is to be localized. Only you can see the epithelium has got effacement of the food processes. So there is effacement of the food processes, which is on the side of the epithelium. But the basement membrane is absolutely normal. There is no change in the structure of the basement membrane. So these effacement in the food processes leads to loss of all the microproteins from the body. So that results in nephrotic syndrome. In focal segmental glomerulosclerosis, you will see that in certain areas there is going to be sclerotic patches. So sclerosis is present in some of these areas. So that is the name for focal segmental glomerulosclerosis. Then we have membranoproliferative glomerulonephritis. So membranoproliferative mein again you have type 1 and type 2. Type 1 mein you have subendothelial deposits. That means inside this part, subendothelial deposits are present in type 1. And in type 2, you will have dense deposits which can be localized. So these dense deposits or intramembranous deposits are classical, which gives a look like a sandwich appearance. So this is going to be present in type 2. So these are all the various types of nephrotic syndrome that you should be aware of. And it is very commonly asked in the exam. Then in membranous nephropathy, you have got epithelium and effacement of the food processes also right over here. There is effacement of the food process, and we have a very thickened basement membrane. So the basement membrane becomes very, very thick. So this is one thing that is very classical for membranous type, and we have got subepithelial deposits. That means right on the top. It is not subendothelial, it is subepithelial that is present in the membranous type. So you should be able to localize the changes that is present, and you should understand the type of nephrotic syndrome that we are dealing with. Okay. All right. So since we have discussed all the important etiology in the nephrotic syndrome, so in next class we are going to discuss about the pathophysiology and the approach towards the management in nephrotic syndrome. So because all of you, those who would be listening to this 2022 target classes, I expect that all of you start to revise the topics as soon as it is finished. So if anybody who is reading out pediatrics, if you listen to the lecture, please revise the topic of nephrotic syndrome. If you do it, you get very intense understanding, because once you listen the lecture, you open your book, you read it, or if you read it straight away from the notes, when you finish the topic, you're totally able to solve the MCQ. So that is one thing that I would request all of you to do, that once you read the lecture and you understand the lecture, please open up the notes, mark it, download it, and you can easily understand the notes. It is well and good. If not, if you need the help of the book, you can mark the important things that has been discussed from the book, and please go ahead and start solving the MCQ. So next class we are going to discuss about the pathophysiology of nephrotic syndrome, and we will also discuss about the approach towards the management of nephrotic syndrome. Okay, so thank you for being so patient and listening to the class. We'll meet soon again tomorrow with the further